There's another recent published paper that under this concept of One Health, because it's not only animal health, it's human health and it's also environment associated. I like very much this approach. There's another wide review, a very systematic review, including a high number of countries, either high income, middle or low income in the 5 continents, affecting not only monogastrics, pigs, of course, but also chickens and aquaculture in a wide scope of ways of producing, intensive, experimental, and in this case, most focused on bacterial diseases. In this case, this study is giving us, under this approach of water hygiene, sanitation, and washing, which is the impact on the infection burden and antibiotic use and resistance. It's quite interesting because it's affecting everything, much more than we expected. The summary of this great work is that a good percentage of these studies inform in a positive way of these good procedures, this wash, intervention, water, sanitation, and hygiene. Up to 18 of 26 reports studied reduced the infection, 37 of 71 reduced microbial loads, 4 out of 5 reported reduced antibiotic use, and 7 out of 20 even reported reducing antibiotic resistance, something that is very complicated to demonstrate.